Good morning. Good morning, everyone. I would like to spend this period to mention to you about the guideline for the new normal after COVID-19. But however, I would like to expand the title of this section. Instead of just mention about safety guideline, I'd like to cover more than that. When we talk about the COVID-19 crisis, we should include four factors, four areas, not only health, but also the economy, also the society, and also the national security. So what I'm going to do today, I will going to share with you my slide presentation now, and then hopefully at the end of the presentation, you might have some idea in order to use this when you go back home and how to set up the new normal after this COVID-19 pandemic crisis. Okay, I hope you can see my slide now. I'm going to, okay, can you see it? Can you see it now? Good. First of all, I would like to show you this slide to give you an idea of what happened in the past and what's going to happen in the future. Since the beginning of this 21st century, there were at least 4 pandemics taken place in this world. The first one is the year 2002. It's a coronavirus. We call this virus the SARS-CoV or SARS virus. The SARS virus started the first case in November of 2002 in southern China. And then World Health Organization declared the end of this SARS pandemic on July 2003. Summary of this pandemic, it involved 26 countries. The total cases was just over 8,000 and the mortality of just over 800. So the mortality is something like about 10%. It relates to the bats, In 2009, there's another pandemic. This time was not caused by the coronavirus, but caused by the H1N1. It's a kind of flu virus called swine flu. The first case reported in April 2009 in Mexico. And then it spread widely, as you can see here. It spread to cover 214 countries. The total case of swine flu was over almost 7 million people worldwide, and it caused death of about 18,000. Just to tell you briefly, the mortality rate of this flu, normally in the seasonal flu, the mortality should be about 0.01. So this swine flu, the mortality was 0.3. So it's more than 10 times, almost 30 times of the mortality of the seasonal flu. In 2012, the coronavirus came back again. And now we call it the MERS virus. From the Middle East, it started the first time in September in 2012 in Saudi Arabia. And then as you can see in this slide, even early this year, in January, there's still some cases reported to have the MERS virus, but no, not the pandemic. During the MERS, it covered 27 countries, altogether about 2,500 cases, but the mortality up to just over 800. It means that the mortality up to about 35%. 1 in 3 die. And 2009, this year, the COVID-19, it started in November in China. This time it also again related with the bats. And up to early this week, on the 9th of August, it already covered 188 countries. The figure at that time, the total case was over 19 million. But for this morning, it's over 20 million now already. The total deaths was just over 700,000. By average, the mortality was about 3.7%. I mentioned all of this just because I would like to raise this. All of this pandemic has been discussed, the cause, the reason why we have so many pandemics since we entered the 21st century, because of the continuity in the climate changes. It's caused migration of the animal. And we know that animal migration, animal health relate closely with human health and environmental health. So the concept of One Health proved itself, and particularly in terms of the existence of the pandemic. I make this slide actually I have a webinar, international webinar 2 months ago, and analyzed what are important factors related to the situation of COVID crisis in individual country. And I classify into 5 factors or 5 categories. The first one is human factor, particularly the social or cultural factor. The belief, the behavior, the discipline, and also the age and whatever are related to human factor. The management factor is the strategy, how the country manage the crisis, particularly at the time of decision. I hope you have heard about the hammer and the dancing strategy to flatten the number of new cases, and then to have the relaxation strategy in order to promote the return of the economy. The time to make a decision to shift from the hammer to the dancing is important. The healthcare system, the balance between the health economies, the national security. The technical factor, the testing, the tracking and tracing, and the vaccine development, these are important. It has been proved, particularly in South Korea. The world situation, as long as you have so many new cases in other countries, you cannot say exactly that your country is safe, as long as the situation of the world situation is still in a crisis. And also the international collaboration. And lastly, the final factor. I put viral factor as the last the last important factor, because there's so many evidence supporting that the viral mutation does not play an important role in the severity of the case. It might make the virus easier to transfer from one person to another, but related to the mortality, it has not a significant factors. Now, I would like to summarize the aim of the new normal. Firstly, the new normal have to create more effective and more efficient lifestyle and working model. เดี๋ยวนะผมต้องการจะปิดภาพของผมตรงนี้ได้ไหมใครสักคนช่วยตรงนี้ผมได้ไหมผมปิดภาพผมตรงนี้ไม่ได้มันขวางผมอยู่ and the second one is the new normal should create a better quality of life. In summary, I mean create wellness to the general population. And lastly, the new normal have to prepare the global population to be ready to face the new pandemic. I mentioned to you in the second slide that because of the continuity of the climate change, we do expect to have another new pandemic in maybe less than 10 years from now. So the new normal have to prepare ourselves. I do believe the world population don't want to go back to the crisis again when we have another pandemic. Factor affecting the new normal. I list these 10 major events that changed the world. This is from the website called Biography Online Net. The first one is the World War I. The second one is the Russian Revolution in 1917. The third one is the World War II in September 1939. The fourth one is the attack of Pearl Harbor by the Japanese Army in December 1941. The fifth one is the atomic bomb that dropped the Hiroshima and Nagasaki in August 1945. And then the Indian independence in August 1947. The Maoist China, I mean the Mao Zedong, 1949. The assassination of John F. Kennedy in 1953. The fall of Berlin Wall in 1989. But you can see 9/11 and also the last event, the COVID-19 pandemic. Why COVID-19 pandemic will change the world? I put out of these underlying causes. The first one, COVID-19 pandemic, highlight the differences in socio-economic aspect between the Eastern world and the Western countries. The increasing role of the Eastern culture. To recall you, when COVID-19 started to be pandemic, among people who reside in the Eastern countries, we use the face masks. And it has been shown quite clearly that face masks, the use of face masks, the physical distancing reduce the number of new cases. But if you, even right now, if you look in many countries in the Western world, they reject the use of the face masks, although scientifically it has been proved. And maybe this is one of the factors that why there's so high incidences of new cases among countries in the Western world. The emphasis on the role of science and technology. Science and technology can help us to cover with the microorganism whenever there is a pandemic. The reviewing of genuine status of international collaboration in terms of health, economy, society, natural security, and the role of World Health Organization. I mean, in the past, people keep saying that we have a good collaboration, a good international collaboration. Whenever there's some crisis, whenever there's some pandemic in some part of the world, this will stimulate, catalyze the collaboration internationally. But for pandemic, which involve almost every country in the world, you can see right now, the international collaboration is not as good as it has been mentioned. World Health Organization cannot do whatever they should do. And some countries reject to join this international collaboration, or even in some countries, they are now spend a lot of money buying some vaccine in order to protect their population instead of giving them to other countries. The gap identification of the management system, the gap between the local and global management, the raw material, the supply chain, and the production. We have some problems, particularly in Thailand. In early March, we did not have enough the N95 mask. We did not have enough the PPE in order to prevent the healthcare professional to be infected by the virus. But all of these things, I mean, we imported from other countries. And even if we would like to produce by ourselves, but there are no raw material, then the raw material could not be sent to our countries. And lastly, to better understanding the submicroscopic infectious agent, I mean the virus. Although the science technology is now, we know a lot about the virus, but I have to say that we do not know all what happened in the virus. The RNA virus keep mutation. They keep mutate them itself all the time. And even right now, we have more than 6 strains of the COVID-19. And we do not know behavior of this virus because sometimes when they mutate themselves, there are some behavioral changes. For example, in the US right now. The number of deaths, there is an increasing in ratio between the youngster and the elderly. The first time when COVID-19 attacked the world, most of the death they confined in elderly people. But right now in the US, number of deaths seem to be more and more among the youngster. So there's a lot of things that we have not known yet. At our hospital, in fact, I introduced the term, we do not use the term new model initially. We do not use the term new normal initially. So far we call the new model. We use the new model in our healthcare services. We use the new model in our education. We call it new model to emphasize that we need some changes. And then we will keep the result of this new modeling. If it works, we might change it into new normal later. And the term new normal, it will be affected by and also can affect the globe. So in fact, I would like to persuade people, initially we should use the term new model. Don't embark ourselves to use the term new normal. On the photograph you can see in this slide, telemedicine, for example. 3 months ago in Thailand, we didn't start any telemedicine. And I do believe at that time when someone said that we can treat the patient online, there might be some argument whether it is a good quality, it is an acceptable quality. But right now we use the telemedicine, and in fact, many patients, they enjoy to have telemedicine instead of coming to the hospital, instead of taking the risk to get infected by the COVID-19. They prefer to have the telemedicine in some selected patients. And we improve, not only in Thailand, but I mean all over the world. They improve the technology for the telemedicine. You can see in the slide, we can hear the heart sound, we can hear the breath sound by using this telemedicine. At the same time, the work from home, we use the internet facilities, we use any communication technology to make sure that we can work at home. And work from home have been proved that the quality of work from home is more or less similar to the on-site working and also the tele-meeting. I will go into detail and give you some example. As I mentioned earlier, the purpose of the new normal, the first one is to create more effective and more efficient lifestyle and working models. There has been more role of technology in daily life, in living, in working. I mentioned to you that when we're talking about the crisis of COVID-19 pandemic, it is not just only on health, it also on economy. It also on society, also on the national security. When we talk about the economy, when you use the conventional method for your lifestyle and working, when you have to ask if there is any pandemic in any countries, usually the government asks all the people to stay home. And when people stay home, it means the economy, there will be the negative impact on the economy at the macro and also the microscopic level. But when we use the technology, we can do some online business. We can do some online work, continue to do working, continue to get access to the economy improvement by using this technology. At the same time, the crisis on the society. If you plot the level of stress, the level of stress increased rapidly during the first few months after this COVID-19 pandemic in every countries. People who are ordered to stay home, who are allowed to just leave home just 1 a week, for example, in China, in Spain, they are very stressful. They would like to talk to someone, they would like to enjoy their social life, but they could not do it. because that will increase the risk to get infected by the virus. And then when we introduce the technology, they can do the so-called telemeeting, the so-called teleconference. They can talk with their friends. They can see their friends' faces. And that can reduce the level of stress. So the new normal will focus more on the increasing role of technology in daily life. The online activities are one of the key mechanisms to improve the effectiveness and the efficiency. Telemedicine, for example, in our hospital, when the government start to ask people to stay home, we reduce the number of services. We cut down to zero the number of patients who should undergo surgical treatment, because we did not want to take any risk on the viral infection. But then what happened is that some patients who got cancer, we need to do surgery on them. Some patients who need some medication and they finish the medication they took a couple of months ago, they would like to discuss with the doctor. They would like to tell the doctors the symptom they have. And so we decided to start the telemedicine. And it worked. It really worked. It really worked. Because some patients got some symptoms, and then they can have some suggestion or advice from the physicians. And even with some prescribed some medication and send it by using some technology. I mean, they need not to come to the hospital to get the medication. We send it to the post there's some private company, for example, the Curry, they can send the drugs, the medication to the home. Also, the work from home. We analyze, also in the hospital, in fact, we analyze up to about 20%, 10 to 20% of some work, which usually we do it on site. We can change it into the online working. We now decide whether we should change it back to on-site or should we keep it an online working. We now conduct some research to compare the result. I mean, the hospital is different from other business. It's a service business, so sometimes we need someone to face the patient, to welcome the patient, so that should be the on-site services, online working. But for example, there's some education that we can do it online. Why not change it to online? The management system, which emphasizes more on the output outcome than the input or the processes. When you move to do the work from home, of course, you cannot do the process. You can measure the output outcome. And if the patient, for example, if your employee, they can do work from home, it means that they need not to spend their time for traveling from their home to the office. I mean, they can work more. They can have even an hour, even more than an hour to work instead of spending time in the car, caught in the traffic. So the effectiveness of work from home may be better, but we need the appraisal system, how to evaluate the effectiveness of the working. You should not measure the process or the input, which you should focus mainly on the output outcome. The work from home can replace several, but not all, conventional type of working activity for a better output outcome, but less cost and less time. If the employee have to work in the hospital, in the office, you can imagine how much you have to pay. For example, the electricity cost for the air conditioner, the cost for traveling, for example, you can cut down, you can reduce all these costs. So there's some work, there's some pattern of work or some category of work that may be permanent changes to do the online working. Adaptation of new lifestyle and working models. This is important by adoption of the new technology and management system is the key. I can tell you, if I discuss about tele-education with my faculties. Let's say 4 or 5 months ago, that medical education at our Faculty of Medicine, we should move toward the online education. I do believe more than 90% or even 100% of my faculties, they will reject the idea, because to teach the medical student, usually we have to teach on site, and we used to do it on site. But then when we started, we tried this in March of this year, when we're going to have, we can identify that we have a threat of COVID crisis. So we suggest our faculties to try to do online education. And then they're happy with that. When we use Zoom, when we use WebEx platform, and then we can communicate with the students. And we realize one thing, the students, they enjoy having this online education. Some of them, they didn't want to wake up in the morning and then rush to do the on-site education. They can do the online education. We have the two types of online education. They call the synchronous and also the asynchronous online education. The synchronous, it means that the student join the class together with other students and also with the faculties. The asynchronous, it means that we record all the activity in the class, put it in the web, in the server, and then the students can retrieve from the server and study anytime when they have time or they would like to study. So when we combine this synchronous and also asynchronous, most of the students, they enjoy having this tele-education. And we continue this. We plan to do this online education for the theory up to maybe December of this year. For the practical, from the laboratory classes is different. We are now trying to figure out how we can do the laboratory classes or experimental classes. Of course, we cannot do it 100% online. We try to do it. We try to design what we can do in order to make some of these laboratory class or practical classes in the online technique. So the key word is the creativity, innovation. You have to think out of the box. You have to think something different from what you did in the past. And please believe me, something that have not been done in the past doesn't mean that it will not work. If you don't try it, and then use the methodology to measure the outcome and compare to what happened in the past, and then you might have some novel method of services or teaching and learning. Adaptability means world keep changing. We need to adapt ourselves to the situation, and I do believe that we will be more and more rapid changes because of the climate changes or whatever. So we have to adapt ourselves to the situation. Agility means easy and fast to move, easy and fast to change. Not only to adapt things, but we also easy to adapt the things and also easy to move or to change. And flexibility, be flexible. Anything that may not be the best, but is a proper, sometimes we have to take it. We have to move to set up the outcome as the optimum, not the maximum. That's the meaning of this flexibility. Better quality of life, which means the wellness. When we talk about the quality of life, we should include the physical health and also the mental health. For the physical health, the concept of new normal is to create the independency, the situation of more and more independency. In the past, the patient would like to be treated. They have to depend on the physician. They have to come to the service to get service in the hospital. They have to see face-to-face with the physician. But now we're going to do it more independency. They need not to come to the hospital. Or even sometimes they can study something through the internet. They can learn something, some knowledge about health through the internet. and modify themselves, the so-called the self-directed, use the technology to promote their health, also the telemedicine. For better mental health, the self-entertainment. As I mentioned earlier, there's some study measure the level of stress and seems to be rapidly increased when during this COVID crisis. But I do believe someone has to know how to manage the stress. They have to know by themselves how to do the self-entertainment. The term self-entertainment, it means they can entertain themselves regardless there will be other people with them or not, with or without technology. Sometimes self-entertainment need no technology. For example, someone enjoy just watching the television, some enjoy just the reading, or some enjoy the meditation. There's no need for any technology, but if you can find out what kind of activity you can relieve your stress, you can entertain yourself, please try to do that. Try to make yourself used with those activities. And also, I would like to emphasize this social proximity with or without physical proximity. It means you can enjoy the social life with or without physical proximity. It means you can enjoy the social life by using the telecommunication technology. You can see your friends, you can discuss with them without it, while you maintain the physical distancing in case there is another pandemic. Start doing all these things. You need not to wait until another pandemic before you try to use this technology. Use it now. Prepare yourself. So whenever there is another pandemic come, you can have your lifestyle just like the norm that you start doing now. Maintaining or having better socio-economic status. When I say the term wellness, it is not only the health, it also involves the economy. So how to gain economic growth while there are some pandemic in the future, new jobs, new pattern of working, new business. For example, in Thailand, I mentioned to people from the government that, in the past, Thailand, the main income of the country come from the tourism. We enjoy having millions of tourists from abroad spending their money and improve the level of economy in the country. What will happen if there's another pandemic? The number of tourists to Thailand during the past 3 months almost zero. It means the economic growth is now in the state of recession. But if we decide to move to some new type or new pattern of business, for example, I mentioned to many people in the private sectors, the reputation of Thailand right now is quite good on health. We have a very, very low new cases. We have very, very low new death in the COVID-19. We have some innovation, produce some kinds of, for example, the reuse of N95, the innovation of the suit to prevent healthcare professionals from viral infection. Why not? If we decide to expand this, to set up the new business, to produce the health or medical inventions or equipment. If we use this advantage and we introduce some new methods or some new technology or new equipments, the only obstacle, there are two obstacles, the raw material and the international qualification or the standard. We need to pass the international standard. We need to make sure we have enough raw material. And if the private sector decide to export on these two obstacles, and then we can produce raw material by ourselves, and we can pass the international standard. I mean, in the near future, if there's another pandemic again, no tourists get into the country, but at the same time, there will be the upscale of this new technology to produce the medical equipment and export it to countries which have been attacked by the new pandemic. It means we can balance the economic status of the country. That's an example. The ability to keep social connection without physical distancing using technology, whatever. I put some of this slide. You can see that right now, even the elderly, they can get access to the technology easier compared to 2 or 3 decades ago, when information technology was quite difficult for the elderly to use, but the design is quite friendly. Ready to face the new pandemic, mainly to reduce or to control the damage. When I said to control the damage, I include also the health, the economy, and the society. And lastly, if we cannot manage the damage on health, economy, and society, it will affect the national security. The new kinds of business, if we prepare ourselves, introduce new kind of business, of course, in the near future, whenever there is another pandemic, we will not be interrupted by the pandemic. So, issue of concern. The majority of new normal, I would like to emphasize again. When we said a new normal, it means that most of the time it's a permanent changes. It does not mean that when we finish this COVID-19, everything back to what exists before the COVID-19. The new normal should be something that causes permanent changes. Change management is crucial. There are some people, for example, education in Thailand, particularly in the primary or secondary schools. I think the government have not done enough for the change management. Many teachers in the primary or secondary school in Thailand, they have not prepared themselves for this new normal. My kids, they are now working in the school in the rural areas of the country, and then they send a message to me that almost more than 90% or even almost 100% of the teachers who work in the rural area in Thailand, they believe that after this COVID-19, everything will be back to what happened in the past. Have an on-site education. So they decide not to invest their time to learn how to do the on-site education. It needs a change management. It needs someone to guide them. It needs someone to tell them what's going in the future. I do believe there will be another pandemic. If they do not change themselves right now, they will be suffer again when the new pandemic attacks us. Change should be started as soon as possible. Need not to wait until the next pandemic. If you look at the first slide that I mentioned, the first attack of coronavirus, 2002. It took us 10 years before the second attack of coronavirus in 2012, the MERS. But for the second and the third attack, it took just only 7 years. From MERS 2012 to COVID-19 in 2019. And in fact, in between 2009, we have the flu, the Swine Flu. It means that you can expect from evidence in the past, there should be less than 10 years for the next pandemic. If we do not start it now, who knows? It might be COVID-25. It might be 3 or 4 years from now, there might be another pandemic. So start right now so that when you start something new, you need some time to improve it. You need some time to stabilize it. So if you start it right now, it might take 2 or 3 years. And then at that time, we have a standard protocol on online everything, online education, online service, online working. And then when the new attack comes, we need not to get into any trouble again. So do it now, or do it as soon as possible. New normal should have the positive impact on health, economy, society, and national security. So when you start something new, you need to do some research to measure the outcome and compare the outcome with the outcome in the past and see whatever you can improve the outcome. As I mentioned to you, I prefer to use the new model now. When we use the new normal, the new model, we will measure the outcome and compare it, improve it before we use the term. And when we settle down, what we're going to do, we use the term new normal. So the keyword is the creativity, innovation, acceptability, agility, flexibility. Again, I would like to emphasize, when you use the term new normal, you need to think of the box. You need sometimes you have to discard doing something that you used to. You have to do something new. Unuse what you have used and reintroduce, use what you haven't done before. You have to think about innovation. You have to use some technology to improve you. So you have to discuss with someone, particularly engineer, the IT people, raise the question, what you're going to do, and then they exercise their knowledge or skill, and then they come back with new technology and use it, measure the outcome, improve it, and settle down the new technology and adopt it to use with your working. Agility is the term, as I mentioned, the flexibility. So these are what I mentioned to you, the new normal after COVID-19 pandemic. Let me summarize the keywords. New normal have to include the impact on health, the impact on society, the impact on economy, and also the impact on national security. When you said the new normal, you mean something that creates permanent changes. If you use it temporarily and then you measure the outcome, it didn't work, you went back to use the same what you used in the past, you could not call it the new normal. So prefer to use the new model. It didn't work, it worked, we call it the new normal. You use the new normal not in every activities, in some. I do believe something in the past still work in the future. So you just identify something, some activity in the past that will not work in the future. Use creative innovation, create new things, and then use it as the new normal. So that's what I mentioned to you all. Prepare yourself for the new pandemic, and you will not be suffer because of the new pandemic. Any question? I think the system allow you to ask some questions, and then I will respond to you. So please.
So thank you very much, Professor Prasit. I hear some compliment of your talk about inspiration of the word innovation. From your presentation, I think I would like personally to ask about innovation of the way that the hospital medical school giving or providing the service to the patient. I think so many ways. Also, I have heard that the Sirelat Hospital has produced the mask, which is I think is the innovative equipment that you are doing here. Okay.
Okay, let me focus on two aspects. The first one is the healthcare system, and the second one is the new product that we use our research technology and to produce some kind of mask. The first one is the healthcare system. In fact, we started the project to make Sila as a smart hospital almost 1.5 years ago. At that time, our concept, our purpose is to make a patient more convenient to come to the hospital and make some patients who need not to come to the hospital still have the high quality services. And because of the COVID-19, it catalyzed the speed of the changes. So right now, the so-called Sila Connect, that the application in the mobile device that the patient can connect to us, they can book or they can look at the queue. If they would like to see our physicians or our faculties, they can book online to their mobile device, and then they can come to the hospital exactly on the day or even exactly the time they have been booking. And then when they finish visiting our faculties or our doctors, they can rush back home, and then we can send them the medication sent to their home 100% within 5 days, 93% within 3 days. And even they need not to pay the payment by visiting our at the counter. They can pay online. They can connect by scan the QR code, and they connect the hospital with their mobile device and then do the transaction online. We speed up this process, and right now it's quite easy to be used by our patients. At the same time, the telemedicine, we plan to change up to 20% of our patients from on-site services to the online services or telemedicine. We start this almost a month ago. We connect to some patients who are not active in active illnesses. For example, some patients with diabetes, some patients with hypertension, and also they have the drugs which have been titrated. So we know exactly how the dose and the number of the drugs. We would like just to talk to them, and we would like to see the blood pressure that they keep measures, and then they show us the records, and then we see them and they can see us, and then we can ask them any other symptom they have, and then they're happy on doing that because they would like to mention to us. Even sometimes they do not have any new symptoms that they would like to see the doctors. And then when we tell them that we would like to suggest them to have the same dose, and then when they agree with us, and then we ask them whether they would like to have the medication sent on by post to them, and they are all clear on that. They do not want to come to the hospital because of this COVID-19. And some of them ask whether they can do this at the long term. We can say, we tell them that exactly they can do, but we prefer to ask them at least to visit us at least once a year. Yeah, once a year. So it means the remaining, usually they come to see us every 3 months in the past. So the first 3 times we do it online, but the last time at the end of the year, they can come to see us, and then they're happy with that. That's an example. We are now trying to do some kind of to make it more convenient for them, because in the past, some patients would like to do telemedicine, but they have to come to the hospital to take the blood test, to have the blood test. And then we raise the question, we're going to set these facilities. We're going to set up some areas that close to their home. So they go to that clinic, to that hospital, have the blood test, and then we send out someone to take the blood sample to the hospital. We will take the measurement of the blood sample by ourselves to make sure the quality of the results. But the patient need not to come to the Sila hospital. They need not come to take the risk of being infected by the virus. They go to the hospital nearby their home, have the blood test, and then when we go to take the blood sample to the Sila, the result will be online. And then in the afternoon or in the evening, we communicate them by this telemedicine technology. So we know exactly the blood test, the result of the blood test. The patient knows the result, and then we can provide the medication. So by this way, when we mention this to our patient, they're quite happy because you see someone, if they have to do the fasting blood test, they need to fast themselves quite early in the morning, come to the hospital wasting time for the time to have the blood test before they have their breakfast. Sometimes they have their breakfast at 9 or even 10 a.m. It's quite late for them. By having these new facilities, they can go to the hospital, have the blood test at 7 o'clock in the morning, and then they can start having their breakfast. And then maybe in the afternoon, connected by our physician. So all of these activities can be done. We are now using another technology, for example, that I mentioned in, there's some device that is not very expensive. It will cost just only about 20,000 or less than that. It's something like a stethoscope. But when the patient put on the side where the heart located in, it will transmit the heart sound. And even the doctors in the hospital, which quite far away from them, we can hear the heart sound. We can hear the breath sound if we like to look whether there is any abnormal heart sound or breath sound. So it means that we can do the physical examination online. And by this way, the patient will be happy because if there is something wrong with the heart or with the lung, we can pick up it conveniently by using the online technology. So that's the technology on the services. On the products, we do believe that even when we finish this COVID-19, for the future, if we might have some pandemic again, the mask, it might be something like a usual, like we take the shirt, we take the trousers, we take the clothes. It's something maybe in the future is quite normal, someone to take the mask and walk along the street, even there's no pandemic at all. There's some evidence published in the paper that by put the mask in, there's a lower incidence of common flu, the common cold when people use the mask. So we expect to see in the future that someone walking around the street using the mask. And now, so we work together with the T cells and also some advanced lab. By using the technology and research methodology, we are now having the mask, the so-called the wind mask. The wind mask, in fact, there are two components in the mask. There are some technology that prevent even not only the virus, but also the PM 2.5. The wind mask can protect yourself from the PM 2.5. So whatever in Thailand, every year during November up to February every year, we have a very low quality environment in Thailand. The concentration of PM 2.5 is quite high, particularly, I mean, it's usually start in November, but most of the country will be labeled as the red area during November and January. So at that time, if you use this wind mask, if you go out of, walk around in the street, you can protect yourself by using this wind mask. And it's quite cheap, actually, it's quite cheap. I mentioned to you, so far we sell it at the cost of about 55 baht per each wind mask. But for each wind mask, you have to, you can wash it, you can reuse it up to 30 times. So up to 30 times, it means that each time, let's say a month, it costs you less than just only a few baht per day. So it's quite convenient. And we hope in the future, we can see people use this wind mask, even there's no pandemic, to protect yourself from common cold, to protect yourself from flu, and to protect yourself from PM 2.5. So these are all examples of the technology that are available now.
There is a small question from Lohani Jahis. She said that in the situation that the patient didn't have the mask on, the internet facility, this is also include the elderly who are stay in the community.
Right. Okay. We classify the patient in our hospital into two groups. The first one is the patient who get access to the high technology, and the second one is to get nothing with the technology, particularly the poor or someone who come from low social economy. So you see, if half of the patients, they are in the first categories, they need not come to the hospital. It means that we can maintain the physical distancing. So even the poor or even someone who do not get access to the high technology, when they come to the hospital, there will be less chance for them to be infected by, even if there is another pandemic. And in fact, we can serve them much better than we do it now, because there will be less patients visited us. Most of the time they do online. So that will be good on both sides, whether they use the technology or not. If not, they come to have an on-site services. They will receive a better services, because there will be more resources available for us to serve them.
Thank you.
Right.
So no more question online. So I think also the Professor Prasit also have another meeting on the best broadcasting for the radio program. Thank you very much for this. Bye from now.
Okay, I hope what I prepare and present to you will be beneficial to your countries. I know that many of you come from abroad, and even you can continue study right here. You can send some messages to your colleagues in your countries. Some of this content I mentioned in the webinar, international webinar, because I join many webinar, international webinar, and I was asked by many panelists or MC how Thailand managed to handle have a good result with this COVID-19 crisis. So some of them are already in this setup presentation. So please consider it and mention to your friends in your countries, and try to see whether you can modify, you can adopt it to your country or not. And if you adopt your country and have a better result, please share with others. We can share and learn with each other to make sure that the world will be safer with this COVID-19 crisis. Thank you for attending this presentation.